Looking at the plane right there carrying the second American aid worker infected with Ebola as it landed back in the United States from Liberia just minutes ago. The specially equipped medvac plane carrying Nancy Wrightball landed first at Bangor International Airport in Maine to refuel, then continued on to Georgia. And Wrightball is now being taken to Emory University Hospital in Atlanta. That's the same hospital that is treating the other American, Dr. Kent Brantley.
As ABC's Marcy Gonzalez reports now, those patients have been given an experimental drug, and it now seems that their health is improving.
The second Ebola patient ever in the U.S. taken on this medical evacuation plane to Atlanta today. Missionary aid worker Nancy Wrightball coming to Emory University Hospital for treatment, traveling 5,000 miles from Liberia, where she contracted the disease.
Nancy is able to walk around, and really the good news was that her appetite started to return.
Her condition and that of her colleague, Dr. Kent Brantley, who's also being treated here, both said to be improving. Doctors questioning whether an experimental drug they took in Liberia may have helped. Some experts say regardless, they're optimistic about their recovery.
The fact that she's asking for her favorite Liberian dish is terrific news.
Doctors say they're confident the disease won't spread here, and they're taking every precaution. The ambulance used to transport both Ebola patients here will be bleached. All exposed fabric, blankets, and sheets will be burned. And both patients are being kept in isolated rooms at this hospital, sealed off from anyone not wearing protective suits. At other hospitals around the country, the key is awareness, watching out for anyone with possible symptoms. At New York's Mount Sinai Hospital, a patient who recently traveled to the epicenter of the outbreak, West Africa, now being treated for fever and gastrointestinal problems, is in isolation as a precaution.
The first thing we'd like to stress is that odds are this is not Ebola. It's much more likely that it's a much more common condition.
And here, we're still waiting for Wrightball to arrive. Many looking to see if, like Brantley, she's strong enough to walk into the hospital. Marcy Gonzalez, ABC News, Atlanta.